Lupus, an immune system disease that can be quite deadly, claiming the lives of thousands of people each year. From the Lupus Foundation of America, lupus is defined as a chronic autoimmune disease that can damage any part of the body, such as the skin, joints, or organs inside the body. In this speech, I am going to talk more briefly about what lupus is, how it is diagnosed, what the symptoms are, if there is a cure, and what the prognosis is. My information comes from multiple websites and the book, The Lupus Book by Dr. Daniel J. Wallace, and many website articles. So, what is lupus? As stated above, lupus is an immune system disease that attacks many parts of the body, like the skin, joints, and organs inside of the body. As many of you know, the immune system fights off disease, germs, viruses, and keeps us all healthy. Lupus is an autoimmune disease, meaning your body cannot tell the difference between these foreign invaders and creates autoantibodies that destroy healthy tissue. Destroying the healthy tissue from autoantibodies causes inflammation, pain, and damage to the body's skin, muscles, and organs. There are three main types of lupus. The systemic lupus erythematosus is the most serious and affects all of the body, mostly the brain and the spinal cord and other parts of the body. Discoid lupus affects only the skin, and drug-induced lupus is caused by medication. How is lupus diagnosed? The first diagnosis of lupus is finding inflammation, pain, heat, redness, swelling, and loss of function of body parts. According to the Lupus Foundation of America, a physician will carefully review the following while evaluating a lupus diagnosis: your current symptoms, your laboratory test results, your medical history, the medical history of your close family members, such as grandparents, parents, brothers and sisters, aunts, uncles, and cousins. Lupus is also diagnosed by many laboratory tests. There is no single test can determine if someone has lupus, since the test can come back positive and the person may not have lupus but another different kind of disease. Lupus is a rare disease and not many people are diagnosed with it, but many have been diagnosed throughout the years. So, what are the symptoms? Lupus affects so many different parts of the body, therefore there are many different symptoms. According to the Lupus Foundation of America, the most common symptoms for both male and female are fatigue, headaches, swollen joints, fever, anemia, swelling, butterfly-shaped rust across the face, on the cheeks and the nose, sunlight sensitivity, hair loss, and mouth and nose ulcers. Is there a cure for lupus, and what are some of the treatments? Medication is given to patients with lupus to reduce inflammation, pain, rashes, and heat. Regular examinations need to be done with a doctor to make sure the lupus has not gotten worse from what it has started out to be. There are three common drugs that lupus patients often get. One of them is Ulexin, which is an anti-Drogen drug, Ketec, which is an antibiotic to fight infection, and Novatron, which is a cancer medication that interferes with growth of cancer cells. There is currently not a cure for lupus, and it is not contagious, so you cannot get this from other people. It is a genetic disease, or just anything that people can get. So, some facts about lupus. It is nowhere related near cancer and does not start from cancer cells, and it is not related to HIV in any way or form. It can range from mild to life-threatening. People, like I said earlier, there are three types. People can have the least affected one with just the skin, or they can have the severe one that attacks the brain and the spinal and it affects every part of the muscle, joints, anything. At least 1.5 million in the United States are diagnosed with lupus. Women are more likely to get lupus, as well as women of color. So people who have darker skin are more likely to develop lupus than people who are not, like Caucasian people. And another fact about lupus is that May is Lupus Aware Month. You may see purple ribbons or people wearing purple to support lupus patients, since it's the awareness month, just as many other diseases have awareness months. So, my conclusion. Lupus is a serious, unfortunate disease that many people have to go through. I know how serious this disease is. In fact, I have a cousin who is currently going through it, and it is not a fun disease to go through. Treatment and prognosis for this disease is not fun or good since there is no cure right now. Hopefully down the road there will be a cure, and many people will not have their life claimed from this horrible disease.